Hey, what's up everybody? Welcome back to Mad Medicine. In this video, we are going to be talking about the autism spectrum disorders or just autism in general. Now, before we get started, don't forget to like, comment, and subscribe to the channel if you haven't done so, and don't forget to tell a friend. And with that being said, let's get started with talking about ASD, autism spectrum disorders. Autism is a developmental disorder that affects communication and behavior, and chances are you've probably met someone who has autism. So a lot of things that we are gonna be talking about, I bet you already know a lot of it, you just don't realize you know. So ASD is characterized by several key things. They're very key components of autism that many people suffer and many people have to deal with. And those are poor social interactions, social communication deficits, as well as repetitive ritualized behaviors and restricted interests. So we're going to talk a lot more about these characterizations in a second, but for now, just realize that those are the main things that people with autism have to deal with. So diagnosis of autism is pretty important. They must have deficits in social interaction in multiple settings. So this means that they must have it in the home plus school, okay? And that's usually what it means by multiple settings. Kind of similar to ADD or ADHD. They have to have multiple settings of a deficit. Now, this includes failure of back and forth conversation. So if you talk to a patient, if you talk to a child with autism, they may not be able to communicate effectively back to you like a normal kid. They'll have reduced sharing of interests and emotions. So they seem kind of detached from everything. If someone gets hurt, they don't show, emotion and stuff like that. They have abnormal eye contact. Now, this goes kind of back to communication, verbal and nonverbal communication is kind of impaired, and they'll have difficulty making friends. Now, this is kind of common because a lot of kids think that people with autism or kids with autism are weird. It's just that they're different, and that makes it difficult for them to make friends. They also have a lack of interest in their peers, also contributing back to the difficulty in making friends. And then finally, they're used to having repetitive hand motions. So restricted and repetitive motions is another mainstay of autism. And that is simply the most important part about this is adherence to routines, okay? This is very important to understand. People who have autism have to have things a very certain way. They have to make sure things happen a certain way at a certain time. Otherwise, their whole routine gets messed up and it's difficult for them to cope. And obviously, a lot of us have routines, but it's not to this extent where it starts to affect you, and it's kind of a debilitating issue you have to deal with. So that brings us to the main thing, that these symptoms, these diagnostic criteria right here, have to impair function, and they have to be present in early development, okay? And that's the key, the early development part. So that means that often you're going to see this diagnosis occur around 2 years of age. So a classic presentation of someone who has autism is going to be someone who has intellectual impairment. And keep in mind, this is kind of variable because you can also get some people who are savants, right? People who are really good with math or art, or they may have impeccable memory. That happens with autism. Now, it's not common, but it can happen. People with autism or kids with autism are going to have issues with behavior, language, and socializations, and they're going to fail to reach developmental milestones. And often, 4 times more than, not, it's going to be a male who has autism compared to a female. So let's just write that in symbols as well. So a classic presentation is going to be a patient, a 2 to 3 year old child who's brought in by his mother. And keep in mind, this is the USMLE board classic presentation. It's going to be a 2 to 3 year old child brought in by his mother who says that her child is a little bit different than her other children. It could be because she says that he doesn't show interest in what the kids his age do. So if a lot of kids are playing with trucks, he doesn't care for trucks, okay? So that's a lack of interest. He also has to take his stuffed animal, his stuffed teddy bear, everywhere he goes, and that's because that's the ritualized ritual stuff that he has to do, right? So that's another thing. Another thing you could see is when you talk to the child fails to make eye contact, the child doesn't communicate back to you, or he's just mute. And those types of things should tick you off to autism really quickly. And also, don't forget to ask if the patient is vaccinated, because vaccines cause autism. I'm just kidding. Vaccines don't cause autism. If you're watching this and you're like, I knew it, you're retarded. So, just those classic presentations minus the vaccination history, because guys, vaccines don't matter at all when it comes to autism, are gonna clue you off to a patient having autism. Finally, they also have increased head circumference. Now, this is a very small side note that you should know. Chances are you're probably not going to get tested on this, so I'm just going to cross this out. Not that this is wrong, it's just it's kind of not important. The other clues can give away autism more than head circumference. Okay. Oh, if you guys haven't seen this show, it's called Atypical. It's on Netflix. I'm not advertising this, but this kid right here, not that girl, this kid right here has autism. And that's a very, very good depiction. They do a very good job of showing what people with autism have to go through. So if you're interested, if you want a good show, go check it out. Anyways, back to autism, back to the conversation at hand. It's associated with several disorders, specifically Fragile X syndrome, which is an X-linked trinucleotide repeat disorder, where on the X chromosome, they're going to have a kind of blacked out portion. So it's going to look like this on the long arm. So, oh, that's crappy. Let's redo that. Let's erase this. Okay. So what they're going to have is let's say this is their centromere, this is the short arm, and on the long arm, on one of the long arms, it's gonna go like this. So you can see that doesn't mean there's not a portion. It's just when you radio label your X chromosome, the trinucleotide repeat disorder. This is the trinucleotide repeat right here. It doesn't get marked in the radiofluorescence. So it's going to look like the X is, fragile. That's why it's called Fragile X disorder. People with Fragile X disorder also have abnormal facial features, such as long face and big ears, as well as, and this is the giveaway, macroorchidism or large testes. ASD or autism is also associated with males who have the double Y male syndrome. These are just tall males with severe acne. Now, when it comes to autism, treatment is very limited. There's no medical treatment out there that can reverse autism or that we know that can even prevent autism. And it's only given for symptom management, such as ADHD, depression, even OCD, because of that repetitive hand motion or repetitive routines that they have to follow. Therapy is the main thing. It's so important. Early therapy or early developmental support can play a huge role in assisting the child in developing as normally as they can so that they can function. And when they get older, they can also go through occupational therapy so that when they go out into the real world and they're out of their comfort zone, they can easily interact with people and easily go about their day. And with that being said, thank you so much for watching. That's everything about autism. Don't forget to like, comment, and subscribe to the channel. And when you do, don't forget to smash the bell button so you can also get notified every time we post a new video. Thank you so much. We'll see you guys back here real soon.